Before I begin, I want to make sure to thank our sponsors, our fellow sponsors for this, who's the California Wellness Foundation. You can see them up there, and of course, Esri. One of the things I think that strikes me is one of the great pleasures that I have in my job at the California Healthcare Foundation is I get to work very closely with a lot of local communities out there in California. And I get to hear their dreams and witness, in essence, their health data smarts, our collective health data smarts here in California regarding how they want to leverage health data to improve local health and well-being. And I'm not just talking about the usual suspects. We probably can identify and know who they are. Los Angeles, San Diego, the Bay Area, obviously state government as a whole. And they are doing amazing things to make their data available. But also some of the smaller communities that are out there. We're doing some work with Lake County. Our foundation has done some work with Humboldt County or Monterey County. And I think what's so meaningful about open data, in essence, this library of data, of health data that the state is amassing, is that all of these communities now are really going to be able to, they're poised to capitalize on what the state is making available. Because in my mind, open data, we can't really look at it from the perspective of what's the state going to do for us? I think that's really the wrong outlook. It is really important that the state takes the lead role, obviously, in publishing their data. It's significant news, for example, that DHCS is now on the portal. That's momentous. But in my mind, it actually is going to take a village. It's going to be many players, all of us in this room, to make this successful. It's going to take, obviously, the leadership from CHHS, and they absolutely have been leaders over the past year. It's going to take coordination with some of the other state agencies, with city and local government, and Health and Human Services is definitely wanting to do that. It's going to take some organizations, some of which we have as grantees that we're working with, that are really engaged in helping the state do this work. I think of places like Forum One Communications or Perchia Communications, or Stewards of Change, which is putting on this event for us today and tomorrow. But there's another important audience that I think we really need to think about, and that's how can we activate the individuals and organizations that sometimes are outside of government's immediate data orbit. I'm talking here about people like entrepreneurs or citizen coders or some of the frontline providers that really care and know what's needed, or designers and journalists. How can we get them involved? Because I think their role not only should be about what data sets they think need to be made available, which, by the way, is a really important role for those outside of government to play, to let the state know what data should be freed. But they're also, I think, as you know, we need them to build the durable, lasting apps and visualizations and build them at a speed and in new ways that state can't possibly do on their own. So, for example, when immunizations hits the news, and we all know it hit the news about a month ago or so, the New York Times and Washington Post and many local news outlets in California can immediately draw down data from the portal to create important visualizations of findings about what's going on here in California. Or, when WIC locations are published, one of the first data sets that was made available by CDPH, a Sacramento Coding Coalition, Code for Sacramento, can build a consumer-facing app that really can ensure that people out there can use these data. So one of the things that our foundation is starting to do to help catalyze that kind of external use of the data, and this is just getting underway, is we're funding 3 local communities to help them leverage data. This is LA, Sacramento, and Fresno. In essence, what we're doing is we're going to have coalitions in these communities led by a local data ambassador who can sort of be a bridge to the state and also know the local community. And what we want them to do is to build tangible, useful apps that are sort of organically driven. So it's based on what that community needs. And that's what we're focused on right now, one of the many things we're focused on in terms of partnering with the state on this. If you want more details about that specifically, I'm around, just catch me. I also can put you in touch with our partner for this, Perchia Communications. Last year, and it's amazing to think, by the way, that last year when we had this event, as Mike said, we didn't necessarily know for sure whether we were going to move forward with open data. And what a difference a year has made. It's just amazing. But last year I was mentioning, I think during my opening remarks, how optimistic I was about open data moving forward and how optimistic I am about what California can achieve with open health data, given the state's entrepreneurial and innovative spirit. And I was thinking back to my comments, it almost made it sound like as if by magic these data were released, the state of California would take to it and make things happen. And we do have that entrepreneurial spirit. But I want to amend those comments just very slightly. I think our innovative and entrepreneurial spirit is absolutely key in California that really can make this spectacular for our state. But I think in order to make the most of what the state has started, we're all going to need to help build this health data village. It's going to take all of us, inside government, outside of government, et cetera. And I think what's really great about the event agenda as it's put together is that we all can do that. The agenda is built in such a way that we're all going to be hands-on. And so I think I'll turn it over now to Daniel because he can go through the details of how this is all going to work. So thanks, everyone. I really appreciate you're all here.